I have to begin by asking you once again, India, case tally is rising. We've crossed the 46 lakh mark. But the big story that we're reporting today is oxygen shortage. Is that a cause of concern in several parts of the country?
So I think what was done during the lockdown was that the central government had really made a detailed plan for making sure that all states had adequate oxygen and this was supplied at even a district level. The issue, of course, is that there has to be a regular supply. The supply chain has to be maintained, and you have to be able to meet up the need in terms of the cylinders getting exhausted and a backup being ready.
Right.
Most states have been able to do that. In some states, I believe that there is a little bit of a shortage, but I think there is enough supply in the country because when an assessment was taken of the oxygen available in the country, it seemed to be in good amount.
But do you reckon that this is a cause of concern? The reports that are coming in, 3 states specifically that we're talking about, Gujarat, Maharashtra, Madhya Pradesh, where there has been a shortage. In Madhya Pradesh, in a certain district, there's even been deaths that have been reported because of the shortage. So do you reckon it's a cause of concern?
So we must make sure that there is a supply even down at a district level. And if there's a shortage, there has to be a mechanism that it is sort of made up from other areas.
Right.
And oxygen is something which is very important in the treatment as far as COVID-19 is concerned. In my mind, very often it's oxygen which makes a bigger difference than even the ventilatory support. So we must have good oxygen supply available in all hospitals, and it should be regularly available so that you just don't run out of cylinders and then you are left in a sort of a little bit of a mess.
Very interesting. You're essentially saying that oxygen supply is even more important than ventilator support. Let's just shift our focus back to the numbers. India expected now to cross the United States COVID cases in October. Our cases are spiking at nearly 3 times that of the United States. And at these current rates, we're likely to overtake the United States earlier than expected. Does this worry you?
Yes, I think the way the number of cases are increasing every day, and we're now close to 1 lakh cases being added every day, we will actually probably be on the top of the list as in terms of number of cases. But if you were to look at the number of cases per million population, we are much lower, not even the top 5. And I think that's an important thing to remember because many countries are equivalent to states in India. And therefore, in terms of population, we are a huge country and therefore our numbers are going to be huge. However, having said that, we need to be vigilant and take measures so as to be able to bring these numbers down, and very aggressive action needs to be taken.
Right, but a viewer has actually asked us this question: why are India's cases spiking more compared to the rest of the world? Why aren't we being able to contain the spread of the coronavirus while many countries in the world have crossed their peak?
So I think this is multifactorial. One factor is that over a period of time, we were not able to extend the lockdown for much longer period. And once the lockdown got lifted, in many parts of the country, we hadn't reached a stage where you could say we have crossed the peak. Secondly, as the lockdown got lifted, number of individuals sort of thought that this means that that COVID is over, and COVID appropriate behavior was sort of lost, and individuals started crowding. There was no wearing of masks, and even physical distancing was sort of totally forgotten. This led to a huge resurgence of cases in many areas where we had seen that the cases had come down, and a second wave started in these areas. So we have some areas where we are having a second wave, and in some areas where the infection is now reaching, especially smaller towns in rural India. And if you combine the two along with the population of the country, the numbers actually become very large.
Right. It's very interesting, that you attribute the spike in cases to the fact that, we can't afford to have a lockdown. Do you then, reckon in your opinion that perhaps a lockdown or a periodic lockdown might be the only option at the moment to contain the spread of the virus in the absence of a vaccine?
So I think what we need to do is identify hotspots, containment areas, have an aggressive, limited lockdown in those areas. We can't have a lockdown which is countrywide. It will not be possible now, but we have to have limited lockdowns or limited areas, containment areas identified. There could be many in a city. And these then, where we work aggressively in these areas to see that the number of cases come down there. There is door-to-door survey. People are tested. A rapid antigen test is done. and we start isolating people who are positive, and thereby try and break the chain of transmission. By that, you could bring the number of cases down.